that are all curse words.
Okay, so I'll brief through this very fast. Okay, 10 minutes. Last time as you we started with some disclaimer, and I told you that do not sort of mess around with the terminology. So when I say CBME, it is Competency Based Medical Education. When we say GMER, it is Graduate Medical Education Regulation. IMG is Indian Medical Graduate. SLO is Specific Learning Objective. Goals, roles, competencies, assessment and evaluation. Assessment is assessment, evaluation is that of program, assessment is that of a student. Okay, then we saw that there is a document which goes by the name of GMER 2019, in which they defined that we want to create a competent first contact physician for the community. So that was the goal for IMG. In order to achieve that goal, he will be playing 5 roles. 5 roles are CL, P, CL, which means he will be a clinician, he will be a leader in a healthcare team, he will be a professional, he will be a lifelong learner, and be a good communicator. Out of those roles came the competencies. Competencies are already written by the National Medical Commission. We have 132 competencies in surgery. Now we further will break down those competencies into specific learning objectives. Specific learning objectives, then we will decide how we are going to teach them, and then we will decide how we are going to assess them. So it is now competency based, which is more process based. So it's outcome based approach. So the goal is, fundamental goal is to create a physician of first contact for the community. He'll play these 5 roles: CL, P, CL. Okay, so what is a competency? It's an observable activity, which is 132 competencies are given in the handout that I gave you. Then we talked about domains. So there are 3 learning domains. These are not the domains through which we learn, these are the domains in which we learn. So there are mainly 3 domains. 3 domains are cognitive domain, which means knowledge, affective domain, which means feelings, emotions, and psychomotor is that of hand dexterity. Taxonomy, we came to know that taxonomy shows progression in each domain. So if there are 3 domains, in each domain there is a progression. So if in knowledge the basic level is to know or recall or enumerate, basic level, then application of knowledge, that is the second part, and third part would be actually creation. So there are these taxonomy is applicable to all 3 domains. There are various taxonomies in educational field, out of which the one that we commonly use is Bloom's taxonomy. So Bloom's taxonomy, cognitive domain, basic is recall, recognition of knowledge and developmental of intellectual skill. I told you that there are 6 steps in cognitive domain. Fundamentally, recall of facts, interpretation of data, and problem solving. So there is a hierarchy. Each step has many verbs attached to it. Okay, so these were the keywords. So this is just, we talked about cognitive domain. The same applies to, so this is one of the examples that we saw. The same applies to psychomotor domain, which has almost 7 or 8 levels. And finally, we came to, this was an example around psychomotor domain, affective domain. Okay, affective domain also has 6 levels. Finally, it ends with characterizations, 5 levels actually. Okay, so that was example of affective domain. So we fundamentally saw that there is a goal, there are competencies. Competencies are further broken down into specific learning objectives. There is something like Bloom's taxonomy, which describes progression in each domain of learning, 3 domains, and each level of progression has many verbs which are given by it. Okay, so how do you frame SLOs? These 3 things are done by NMC, and this is to be done by our institute. This is our priority. Okay, so educational objective, how do we create one? So 2 things I had told you. One was that each SLO has STEM plus A plus B plus C plus D. STEM, A standard for audience, B for behavior, C for condition, and D for degree. Okay, so These are the skills required by these students fundamentally. So what are the qualities? So each SLO that we create has to be specific, it has to be measurable, we should be able to say that it happened or didn't happen, it was achieved or not achieved. It has to be achievable in terms of the infrastructure and resources, it should be relevant, and it should be timely. So then we saw that there are 4 components. STEM at the end of this sessions, that would be STEM. Then audience, which is the learners, behavior, be able to write at least 3 SLOs, 1 for each domain. This was the behavior. Criteria was without any referring to any resource, and degree was accurately. Okay, and then we had also seen some examples around it. I told you that audience is the learner, behavior is what he or she should be able to do. So this verb is the most important aspect. That is what we are going to pull from Bloom's taxonomy. And degree is to what extent, like 80% of the time, 90% of the time, if within the error of 50 grams, 1 kilo, whatever. So that is the degree. Okay, so that is where I told you that the way it connects is that for each SLO, this behavior, that is the verb, that is to be taken from Bloom's taxonomy. Okay, and then finally we saw some exercises. Okay, so that is it. So again, I'll tell you that there will be multiple SLOs for each competency. The behavior, that is the verb that you use, that is what is going to lead us to what will be the teaching method, and that is also what will lead us to how it is to be assessed. Okay, so that is where we were. So let's start with today's okay, so this is the second part of sensitization program, and we are going to take majorly 2 things, that is teaching learning method, and second is assessment methods. Okay, so as I told you, this pyramid stands for 3 things. Okay, one is that you have to create an objective. This entire thing is known as educational process. First, there should be objectives. Depending on that objective, the verb that has been used in this objectives, we will decide what is the teaching learning method, and the same will also decide what is the assessment. So we will decide what to teach, we will decide how to teach, and finally we will also decide how to test. So today's session will be teaching learning method and assessment. In teaching, there will be knowledge and skill. Knowledge teaching will be large group, small group, some innovative methods, and finally how to use media. Skills would be clinical and practical skills. Assessment method will just talk about a wee bit into what is internal assessment and what is formative assessment. So assessment can further as well be the way there is teaching of knowledge and skill, the same way there is assessment of knowledge and skill. The knowledge can be through writing appropriate essay question or short answer or MCQ, fundamental written test, and skills would be assessment of practical and clinical skills. So these are the main sections ke je apne aje jovana chahiye. Fundamentally, all the teaching methods are divided into large group and small group. So now this section we are beginning with talking about teaching learning method. Okay, so teacher in CBME is considered, is expected to work closely with the student. He should focus on knowledge application. So knowledge application is, the hallmark how CBME. If someone asks you if you can describe what is CBME, then they also say that it just means good assessment, and why it is so, we will talk. Making learning contextual, so he should make use of that knowledge, create educational opportunities, like teacher will create educational opportunities. And finally also provide effective feedback. Current students, as we all know, are tech savvy, they are less patient, and they are more distracted, easily distracted, and they also like multiple approaches to learning. So you can clearly see that the game of teaching, is really difficult now than how it was earlier. Last time I had a session on use of effective media in revised basic, and I talked about that. If you look at the way we studied, even I am somewhere in the intermediate, but how senior doctors like Dr. Jayesh sir or anybody studied when they were students, and I am not even talking about college, I am talking about school. So your teacher is on one part, and your teacher has to directly connect with your mind, okay, because he has to teach you. But how many things are really distracting your mind? Very few. At that time, 30-40 years back, very few things. At the most, શું હોય કંઈ ઘરે કંઈ ગઈકાલે થયું હોય અથવા તો કોઈ ચોપડી વાંચી હોય, or else there's a movie that I wish to see, something of that sort. nothing else, and nothing in that moment. Okay, right that moment kaso distracting now. Now today's teacher is fighting what all distractions. I mean, they are countless, right? I mean, you are literally fighting a trillion or zillion dollar industry in the classroom in order to pull their attention from everything else in the classroom. So the game has just grown a way more harder, and I believe that it doesn't mean that we will be redundant, but it definitely means that if we continue to teach, if we continue to do that, then students are really not interested. We really need to level up. So various teaching learning methods, they can be teacher controlled or learner controlled, and basically group size controlled. So teacher controlled are lectures, symposia and demonstration, whereas learner controlled are project work, something that they do out of the classroom, case-based learning or problem-based learning. Of various teaching learning method, I will just tell you that this is what we are expected to do, okay? So group size based mainly, lecture, symposium and panel discussion, mainly we will talk about lecture. Small group and finally individual method. So if you look at that competency based, that larger printout that I had given you, out of which there is, probably it is not written, the division is not given in here, but the division is clearly given in GMER, that out of 100% of lectures or 100% of teaching that surgery will do, 30% only will be lectures. 30%. So you can imagine that the rest of the 70%. So 30% lecture, about 60% small group, and about 10% self-directed learning. Okay, so you can imagine that the lecture, if we think that we'll just go and take lecture, then that is no more going to do. Okay. So of course, small group versus large group, if you see, the feasibility is of course very high in large group. You can take 250 student, 500 student in a large lecture hall and just take lecture, okay? So that is very feasible if you just want to brush up some info. It is not for application level knowledge. It is just at the level of Miller's pyramid K. That means nose. તમારે ખાલી આપી દેવાનું કે નવો ટોપિક છે પેન્ક્રિયાસ ચાલુ કરવાનો તો પેન્ક્રિયાસનું બેસિક તમારે શીખવાડવું હોય, નોટ ડિટેલ્સ, બટ કે આપણે આખું પેન્ક્રિયાસ ચાલુ કરીએ એ પહેલા orientation sort of, like just you're introducing a new topic, right? So that is high, but it is not appropriate in small group, because small group would have very in-depth discussion. Domain, you can go up to KH and only in cognitive domain, whereas in small group you can effectively teach any domain. And learner variability is of course not addressed, goes without saying. It is usually careful presentation, it's more economical, it is effective for introducing or updating info, and usually provides an overview of a topic. It is passive audience, of course there's some amount of interactivity. In fact, interactive lecturing is a new topic in itself, and there are few methods whereby we will be able to overcome that boredom that most audience feels. Issues of attention span, all learners are of course treated at the same level. Pace of learning and type of learning, both are not addressed, and in Miller's level you can go up to KH sometimes, but by and large. So how do you plan a good lecture? So you first and foremost is prepare, okay? So what does preparation mean? So preparation is not only I would go through that topic or I would read that topic in the book, but you should also look at if there is anything new that has happened. So if you want to look at some articles, if you think that you are going to show or demonstrate something, then do you have that hardware with you? Do you have that facility? So all that is also comes under preparation. Recap the previous lecture. If you know that there is a continuous thread that is going on, you can just recap. Organize the material. Now just look at this diagram, that this is the attention span or level of attention, and this is the time. So as the time grows, initially the attention will increase and then there will be a dip. But it is commonly seen that when the lecturer announces, and now I'm about to end my lecture, then again everybody wakes up, oh yes, fine. Right? So in the end also there is slight attention increase you can see. So how do you address this dip? So you need to address this dip in attention. How do you do that? We'll see 2 or 3 methods for it. Encourage note taking. You can tell them that please write this down, this is important. Summarize in the end, and finally share resources if there were any specific that you shared. What is a symposium? It's a series of talks prepared by few experts. But ये लोग separate topic ले. So symposium is के कोई एक जन, someone begins with introduction, someone takes clinical features, someone takes investigation and management, something of that sort. But it is a symposium is also a large group method. It can also be applied to small group, but it is usually it is still one way. There is no much chance of back and forth. It's a new topic usually is taken under symposium. Talks are short and to the point, and usually no discussion among the participants, and audience is again passive. And of course, that each lecturate that person takes, 1, 2, 3, they have to be sequential and interrelated. What is panel discussion? As we all know, at least 4 speakers and 1 moderator. Each member presents a specific area. Discussion has a structure, and that structure or rule is usually specified by the moderator at the beginning. It's usually orderly and logical sequence, but that maintenance work is done by the moderator. Usually it can happen that someone is, some dominant panelist is there, then he may dominate the conversation or just try and, give more emphasis to one particular side of the entire topic. Okay, so these are just few comparisons between the two. This is dialogue and this is descriptive. So symposium is just lecturing, whereas panel discussion is usually exploratory. There is some amount of audience involvement. Team teaching, I'll just tell you one thing, that integrated lectures, which is a part of integration in teaching, vertical and horizontal, which is part of CBME, is under the umbrella of team teaching. Okay, so why do we use all these methods? Large group method, small group, why should we use all of these? So if you see this particular pyramid, the average retention rates are 5% with lecture. If someone reads on his or her own, then that has 10%. 20% with audio and visual, both, right? It goes on to 30% if that is demonstrated. Now these are all passive methods. The learner is not involved. Now if you go further, if you go for group discussion, the retention is around 50%. If that person practices it, that is 75%, and finally if that person teaches it to somebody else, the retention is 90%. This is taken by NTL at mine. So now I told you that attention versus time, that graph we saw, and then there is a dip, that initially there is attention that increases, then it decreases, and in the end it again increases. So how do you deal with that dip? So successful learning is more than passive receipt of processed information. You have to encourage depth, encourage student thinking, so that you go higher up in the Bloom's taxonomy. So not just at the level of knowledge, or not just at the level of knowing or recall or remembering, but also you go at the level of synthesis, applying, application, etc. So which are the few activities that you can do? So think, pair, share, burst session, case study, incident process, question and answer, and short writing exercises. I will ask you to remember 3, and I will tell you and you will remember it. No worries. So what is think, pair, share? So consider you started a lecture. Lecture is around 40 minutes. 5 minutes have been through, and you now know that the energy levels are going down. Then what do? So you ask them to think on that topic. That now I'm giving you an exercise. It will take around 5 minutes. So you have to think. Consider you are talking about maybe acute pancreatitis. Then what can be the etiology of something of that sort? And then you ask the students to think. So they will think alone.
Pair.
Then they will pair. So they will pair with the person sitting next to them, and then they will exchange it. So that is think, pair, and then one of the two, out of the random group, you can just ask anybody to share whatever they two thought as a group to the whole class. So that is known as think, pair, share. So people will go slightly awake. This is one. Second, I will ask you to remember is burst session. So burst session is if you have 80 students in the class, you can ask them to get into a group of 10, 8 groups, and then you can ask them to discuss on something. So what happens is that creates that background noise. That is why it is known as buzz session. Okay, so buzz session is also another method how you can engage the learners. Case study. So think, pair, share, as I told you, it is the it is shared with the entire class. Sorry? Burst session, as I told you, will take longer time, 10 to 15 minutes. You will give a specific question to or problem to focus on. Group will discuss, and finally they will present. Each group will present. It also stimulates thinking and leads students to higher level. Case study is, if you think that if there is any relevant case, actual patient information that you think is worth sharing in this time, then you can talk about it. What happens is that actually creates a relevance in students' mind that what I'm studying is not something that's going to stay only in books, but it actually happens in real world. Like my teacher has experienced it, right? So you can provide an account of actual case or problem, okay? And then you can maybe coin a word that what would you do in such a scenario. It also encourages critical thinking. Incident process is similar to case study, but it is less formal, and usually you try to address ethics and communication issues or affective domain. Question answer just in the middle of the lecture, you can do that. Now, 2 short writing exercises I'll tell you. So there are 2 discussion kind of exercises. One was think, pair, share, and second was burst session. 2 writing exercises. So you can ask the student to write. You can ask the students to write what? One is muddiest point. So at the end of the session, you can ask them that which point is still not clear on you. Like if you get water, if the water is not clear and it's muddy, so that is known as muddy water. So that is why it is known as muddiest point. And out of this 40 minutes of session, which was it that still is not clear for you? So you just jot it down. 2 minutes you write it down and 8 minutes of discussion on that, but then you also have to clarify that down. So that is known as muddiest point. And second is 3 minute summary, whereby you can ask them to write whatever they learned today, whatever they grasped for 3 minutes on a piece of paper. Whatever it is, they may remember something, some student may write something that the other has not written, and other may write something the third person has not written, right? So these are for engagements. So fundamentally, lecture for large group, you will need to use some intervention in order to involve 2 exercises, think, pair, share, and burst session, writing exercise, muddiest point, and 3 minute summary. Small group methods. So small group is usually arbitrary, but it is still said that anywhere about 2 to 30 is called a small group, especially in our scenarios. So of course there is active participation. Usually you can go to a very detail of a particular specific task. And also there are chances of, there is opportunity for reflection. Reflection, yes?
30 students, it is a small group?
Yes, up to 30 students for us it is a small group, yes. Reflection, and of course you can go to higher levels of Bloom's taxonomy. So what are the pros of small group teaching methods? Is deeper learning and it is customizable. If there is one student who is not taking part or is not participatory, then I can go and involve that student. So it is customizable. You can teach psychomotor skills. IV line kai rite levani, injection kai rite apanu. Those things can be taught in SGT. What are the problem? Of course, time and space constraints, right? It is extremely resource intensive. I mean, we have 250 students coming, and if we go for small group, we will be probably going for 25 each, 10 groups. That is how they are to be defined on the college side. So that means that if there is one session that we decide, or one competency that we decide is to be taught in small group, we will have to ensure that that is taught 10 times over, and it involves, in order to finish the entire class of 250, there are teacher related issues, which of course is time and clinical work, and student related in order to attend, attendance. Sometimes each one of them is not so participatory in nature, they don't want to get involved, right? So there are various methods: group discussions, tutorial, then there are seminars, demonstration, bedside teaching, role play, and workshop. Group discussion is, of course, it's an informal kind of group discussion. There are methods of group discussion like brainstorming, like syndicate or T-team, and even there are still further, so it's an entire world, but let us keep it there. It's small number of learners. Face-to-face interaction is possible. A common goal, you can ask, give a particular question, they can just work around it for a specific solution. It can be informal and it is usually democratic. Now, what is the role of the teacher? The role of the teacher is to ensure that everybody gets involved. Actually, whenever you will attend revised basic course, you will come to know about something like group dynamics, like how does a group actually works, and the facilitator or the teacher's role in case of group discussion is to ensure that each student participates. Role of instructor is to manage the group dynamics. Seminar is what? Seminar is group of person engaged in a particular study meet under the guidance of an expert. So if you see in purest way, then there is no audience. Because even the audience, like right now, this is a sort of a seminar. Because you all already know this. So it is not that I am introducing something extremely new, right? So it can lead to in-depth audience discussion. There is, in a way, no audience, and topic of vital importance can also be studied. And resource person needs to prepare well, of course. So what is a tutorial? So consider you took a long lecture, like you took a lecture for 40-45 minutes on, say, benign perianal conditions. And then now after your lecture, there are few students who come to you and tell you, okay, sir, we have these issues. So then you teach them on that topic slightly informally, and it can as well be in such a room which is not a proper lecture hall, if you have a staff room there or wherever, right? So then that thing is known as tutorial. So if you meet the lecturer either on one-to-one session, even one student can come, that I have these questions, can you please address them? Usually in lecturer's office, students need to prepare well. Now before tutorial, it means that he has to have attended that lecture. Tutorial disadvantage, one of the things they say is that students don't attend the lecture and then they directly go to the teacher personally that can you please explain this to me. Now you have not...
What kind of private tuition?
Yeah, you can... Yeah, it is mainly for query, but it is said that tutorial is informal. It is not that you will address them. You will address the specific issue that they have in this. You come with that, and that means he needs to have at least filtered out the whatever he already knew. So it is basically used to clear doubt after a main lecture. Lecturers know that students often find it hard to speak up even in small groups. એટલે એ વખતે ત્યાં ના પૂછી શકે તો કે ભાઈ તું એટલીસ્ટ પછી આવીને પૂછી લેજે વાંધો.
ચિરાગભાઈ જ પૂછી શકે.
Demonstration, mainly goes without saying, demonstration can be either on real patient, like when you are teaching someone for abdominal examination, of course after the consent of the patient, or it can be in the simulation, which means skills lab. Bedside teaching we all do. There are actual guidelines around how to teach on the bedside. The few very simple ones are that you should inform the patient. Ideally, you should not have more than 5 students per case. If at all you think that you are going to allow everyone to palpate the abdomen, then that also patient should know. If at all patient refuses in between, then you should say that be done later on. Also, do not ask closed-ended questions, ask open questions like what would you do, how would you do, or you cannot say that palpate the spleen. You can instead say that please palpate the abdomen, and then let the student come up with the answer. Role play is mainly used for affective domain. આપણે કોઈને consent કઈ રીતે લેવી અથવા તો પછી how to deal with grief, breaking bad news, એ બધું શીખવાડવું હોય, that is when role play is important. Role play ક્યાં કરી શકાય? So one of the ways, either I can play one of the actor, so the teacher can play as one of the actor. Another way is there are already standardized patients, there are simulated patients who can be created, like we can develop patients, we can develop actors to simulate disease, and they can be kept in the skills lab. It allows in development of communication skills and attitude. So how do you select a teaching method? Of course depends on group size. તમારે કયા લેવલે જવું છે Bloom ના એ બધા પર છે. So where does Bloom matter in this? So consider that you have a competency for which you have written as a SLO, you have written that at the end of this session the student should be able to enumerate 4 causes of acute abdominal pain. So what have you written? Enumerate. Which was the verb that is used? Enumerate. Enumerate means basic level. It is nose level. એમાં એને apply નથી કરવાનું. એને એવું નથી કહેવાનું કે he should be able to come up with, or rather he should describe at least 2 differential diagnoses of right lower abdominal pain. એ higher level થઈ ગયું. પણ ખાલી enumerate લખ્યું છે verb. So that means it is pure recall. So if it is pure recall, then does it need small group discussion or small group teaching? No, it can be enumerate means basic છે ખાલી recall છે, so K level છે, so that can easily be done in a large group. So that is why that verb in the SLOs that we create is so important, because that is what will guide us to kઈ teaching learning method પસંદ કરવી, and that is what will guide us to how to assess it. Of course, it depends on the kind of time that we have, which is the domain. So if you know affective domain hoy છે, the affective domain is not usually taught in large group. Okay, affective domain you cannot in fact teach in large group. But what can happen is, consider there are some rules around talking to patients. Then those basic rules you can orient students in large group. But otherwise, affective domain you have to teach in small group. You should of course know the learners if they are first prof, second prof, third prof. There are many innovative methods. Okay, I will talk about one, because this is important and probably it will form a major part of CBME. So a newer method, newer means it is used in elsewhere for long, but now because in CBME we are introducing it to medical education. If there are two methods that form hallmark of CBME in case of, as far as the learning is concerned, then one is self-directed learning, which is a topic in itself, and I have not included that today. The second one is problem-based learning. Okay, so what is problem-based learning? કોઈને બી ખબર છે problem-based learning એટલે શું, અથવા નામ ઉપરથી કઈ આઈડિયા આવે છે કે what it can be?
જે પ્રોબ્લેમ હોય એનું સોલ્યુશન લાવવા માટે શીખવાડવાનું. બેઝિકલી ફર્સ્ટ
રેસિડેન્ટની જે ટ્રેનિંગ હોય છે, એડમિટ કર્યા પછી
ફર્સ્ટ
પેશન્ટ
પેશન્ટ પેશન્ટની કન્ડિશન એમાં શું થઈ શકે પ્રોબ્લેમમાં એ.
સો પેશન્ટની કન્ડિશન એમાં શું થઈ શકે એ. ઓકે, કોઈને બી બીજાને ખબર છે problem-based learning એટલે શું?
પ્રોબ્લેમ સૌથી પહેલા એડ્રેસ થાય અને પછી એનું સોલ્યુશન લાવવા માટે જે લર્નિંગ આવે.
પણ નહીં, એટલે consider that someone tells me that Ravi, you are to conduct a PBL for the group of these 20 students.
So you have to ask that,
so
what is the problem? What is
કરવાની છે, પણ એક્ટોપેક્સી મને ખબર ના તો ક્યાંથી ખબર કરવાની? That is one of the problem.
તો પછી તમારે જાતે જ તમારા જાતે પ્રોબ્લેમ 10 ક્રિએટ કરી.
So consider that I am going, someone tells me that Ravi, you are going to take PBL for these 20 students. Okay, so what do you think will it look like? કઈ રીતનું થશે, પછી શું લાગશે, હું શું કરીશ અને શું થશે?
એટલે ટોપિક આપેલો છે.
ધારો કે one topic you have, એના જે
I have a topic named abdominal pain in young male.
એબ્ડોમિનલ પેઇન ના 10 જે કોમન પ્રોબ્લેમ હોય એ તું એન્યુમરેટ કરીશ અને એને કઈ રીતે સોલ્વ કરવાના એ 20 છે.
Okay, fine. So it is not that. So I'll just tell you. So what is problem-based learning? Let's not go to the slide. I will describe it. So it has. Consider you have a group of 10 students, 20 students, 10 students. Now, PBL technically is considered like જે span હોય, like lecture 40 minute નો હોય, તો એ રીતે PBL જે હોય એમાં 2 contact session હોય, મતલબ 2 વાર students મળે, અને એની વચ્ચેનો intervening period જે હોય that can be anywhere between 2 to 3 weeks. Okay, બરાબર? So first contact છે 20 students આઈને મળ્યા, હવે they know કે આજે અમારું PBL છે. Now I come up and I tell them that 28-year-old female presents in surgical OPD with complaint of abdominal pain. That is it. Puru. Okay. So what will they do? So they will sit and they will discuss amongst each other and they will find out કે હું બીજું શું પૂછીશ. હજુ તો એ લેવલે ચાલુ થશે. I am not even telling them કે એને vomiting છે કે નહીં. They will prepare a questionnaire and they will then tell me કે sir એને vomiting છે. So then I'll be like yes, vomiting છે કે નથી. Right? Now that discussion, you can say that even up to examination can go on in the first session. Okay? Then they will, now, okay, let me first just finish. Then they will go and self-study for maybe 2 to 3 weeks. After that, the same group will assemble again. They will write everything down like a proper logical sequence of the fate, of the fate of that, what would that patient have, Once they jot it down at a common place, then they as a group will present that their learning or their finding or their flow in the second session. Okay, now it has two methods. Now one method is known as આપણે જે રીતે સસ્ટેન્ડ રિલીઝ ટેબ્લેટ હોય ને એટલે તે સ્લો રિલીઝ ફોર્મેટ હોય. એટલે એમાં કેવું હોય કે હું એવું જ કહું કે 28-year-old ફિમેલ એબડોમિનલ પેઇન, પછી એ લોકો બધું ફમ્બલ થાય, પછી અધવચ્ચે પૂછે મને કે સર આમાં આવું છે તો કે ઊભા રહો, એને એક વારની વોમિટિંગ બી છે, પછી થોડીક વાર પછી પાછું પૂછે આ સર એને ફીવર હતો, ઓકે ચલો એક વારનો ફીવર આવેલો છે, રાઈટ. સો દેટ ઇઝ સસ્ટેન્ડ રિલીઝ. સેકન્ડ ઓપ્શન, સો સેકન્ડ ઓપ્શન ઇઝ I can give a actual short case history, full, and document આપી દો. So now if I'm doing everything, if I'm asking them to do everything, then what am I doing? Okay, of course the question arises, then what's the role of the facilitator? So the role of the facilitator is to guide. When they are discussing during the first time, you have to ensure that they are going in the right direction. You don't have to bring them to the right direction, but if they are going absolutely haywire, then you can nudge them. That maybe do you think આ ફિમેલ આટલી છે, આમ તેમાં તો મેલિગ્નન્સી વિચારશો કે તમે આ વિચારશો, something of that sort. So just indirectly nudging them and trying to bring them on the path again. Okay, એ બધું પતે. બીજું એક ફેસિલિટેટરનો રોલ હોય છે, that is to suggest resources. આજના જમાનામાં આપણને એવું લાગે કે બધાની બધા રિસોર્સિસ છે જ, અને ઓફકોર્સ છે, but still you can suggest some resources. You can also tell them કે તમે લોકો જઈને પછી વર્ક કઈ રીતે કરશો એકબીજા જોડે, કારણ કે તમારે તો ગ્રુપ તરીકે જ વર્ક કરવાનું છે. ઓકે, અને બધું પતે એટલે યુ આર બેસિકલી વોટ આર યુ ડુઈંગ, યુ આર નોટ ટેલિંગ એની આન્સર્સ. એ લોકો બધું પતે એટલે નેક્સ્ટ ટાઈમ જ્યારે એ લોકો આવે તો એમનું 1 કલાકનું પણ પ્રેઝન્ટેશન હોય કે જેમાં એ લોકો કહે કે સર તમે મને 3 જ સિમ્ટમ આપ્યા, તો પછી જો ચોથું સિમ્ટમ આ હોય તો અમે એને આ રીતે ઇન્વેસ્ટિગેટ કરીશું, એને આ હોઈ શકે ને એને આ રીતે મેનેજ કરીશું ને આ કરીશું. ધારો કે ચોથું સિમ્ટમ આ હોય તો પછી આ હોય ને પછી આ, એટલે દે વિલ એકચ્યુઅલી થિંક અરાઉન્ડ બ્રાન્ચિંગ, લાઈક આપણે જે રીતે એબડોમિનલ પેઇનના ડીડીઝ, યસ, આખો ફ્લો ચાર્ટ બનશે. સો ધેટ
ફ્લો ચાર્ટ,
યા, એટલે એ રીતે, રાઈટ. સો બેસિકલી ઇટ વિલ ક્રિએટ કે ભાઈ એણે વિચારવું પડશે કે ભાઈ આ ડાયગ્નોસિસ ખાલી એબડોમિનલ પેઇન છે, પેઇનની સાથે જોન્ડિસ છે અને વોમિટિંગ છે, નથી પેઇન છે એની સાથે ફીવર છે, વોમિટિંગ છે, શું છે શું નહીં. સો દેટ ઇઝ હાઉ દે વિલ ક્રિએટ. સો દેટ મીન્સ કે the differential diagnosis of abdominal pain in that those 20 students will be far better than if you would just go and teach them. કારણ કે હવે આપણે પોતે વિચારવું પડશે, 4 વસ્તુઓ પોતે નક્કી કરવી પડશે. So this is known as problem based learning. One contact session, a week or 2 week or 3 week to work on, and then presentation as a team. Okay, so this is problem based learning. It forms a very important part. So group of students can be given any scenario, they discuss and iterate over what. Yes,
એ લોકોને ટોપિક જ ખબર ના હોય તો પછી એમાંથી કેવી રીતે જાણી શકે બધું?
એટલે
એમને
ફર્સ્ટ કોન્ટેક્ટ મીટમાં તો કહી દીધો હોય ને ટોપિક.
let him please complete it.
તે ખાલી એક્યુટ પેન્કાઇટાઇટિસનું તારે પ્રોબ્લેમ બેઝ લર્નિંગ તારે કરવાનું છે, પણ એને એક્યુટ પેન્કાઇટાઇટિસ શું છે એને ખબર ના હોય તો
એટલે ઓકે, સો આઈ વિલ આન્સર. વસ્તુ એ છે કે ઇટ ઇઝ નોટ નેસેસરી કે દે વિલ બી સેકન્ડ પ્રોફ સ્ટુડન્ટ્સ, દે વિલ બી either third prof or third second. One. Secondly, you will never go with for in order to sort of teach acute pancreatitis or systems. It is usually for case scenarios like you start with symptoms. કે symptoms ને DDs હોય ને એ પ્રકારનું જાય. એટલે maybe elderly male with chest pain, બસ that's it. મેડિસિન નું હોય તો ખાલી એક જ વસ્તુ પૂછીને મૂકી દી.
અંડરગ્રેજ્યુએટ માટે વધારે છે ને.
હું તો વિચારું, ધારો કે પેશન્ટ આવ્યું આપણે ઇમરજન્સીમાં, હિસ્ટ્રી હોય છે એબ્ડોમિનલ પેઇનની, એન્ડ રેસિડન્ટ આસ્ક ન્યુમરસ ક્વેશ્ચન, અને આખા દિવસનો જે ટાઈમ ગયો વચમાં અને બીજા દિવસે આપણી સામે જે પ્રેઝન્ટેશન કરે એ 2 કોન્ટેક્ટ સેશન ક્યાં વચમાં પીરિયડ 2 to 3 વીકની જગ્યાએ ખાલી 1 ડેનું હોય. That is also problem based learning.
We cannot say because I don't know, we would not really go in definitional games.
એના ગાઈડન્સ વગર જઈ રહ્યું છે, એના ખાલી સેકન્ડ સેશનમાં ગાઈડન્સ મળી.
But honestly, more like they are facing real life scenarios. They are not studying them. Okay, so I wouldn't call it problem based learning honestly. એટલે તારો જવાબ મળ્યો વિક્રમ કે ના મળ્યો?
એટલે મને ખબર પડી એટલે હું એ જ કહેવાનું કે PBL is actually not for UG.
It is for
It is
UGs.
for-
એટલા માટે સારું ના કહેવાય કે એ લોકો એમ નહીં.
એટલે જ તને સિમ્પ્ટોમેટોલોજી આપે છે, ડાયગ્નોસિસ નહીં.
ખાલી એટલે એના જે ક્વેશ્ચન જે છે it should be towards so there must be a specific questions કે PBL માં અમુક જ ટોપિક તમે લઈ શકતા હશો એવું હશે?
Not really. તમે વિચારવા બેસો એકવાર. See, આમાં કેવું છે કે we have just been introduced to this technique. We have not even tried it. If we try it on someone, then we will come to know okay, whether this topic works or this topic is better taught in large group. Jayesh bhai.
See, we can just ask the patient with the growing swelling, what could it be? So then think of the multiple things. Then we add the second thing, the patients, young patients with the growing swellings. Then they think of congenital condition. When we add the another point, young patients having the swellings in the evening and disappear in the morning, then this is the
તું શું
possibility.
કહે વિક્રમ? You are not satisfied yet.
કે તમે જે ક્વેશ્ચન ફોર્મ કરો છો એના માટે they should be familiar.
પણ આપણે question જ નથી આપવાનું. That's what I am saying.
હું એમ
Let them think. Let them think.
let them think એટલે શું પછી
એક જ મિનિટ
જે
સાહેબ.
માણસને એકલો કેવી રીતે ઘૂંટવું હોય એ જ ના ખબર હોય એને
પણ
પેલા
એમને-
એકલો ઘૂંટાડ તો શીખવાડવો
So
પડે ને.
listen. If you tell them all that your question is that you have a patient of 28-year-old female of abdominal pain. That is it. Okay. Now what is your question? That is what we have told them. Now what is the query?
How can they raise the query?
It is an open book exam. They have given time. They have books.
એ વખતે કશું ના હોય.
They can study.
In fact, એ લોકોની પાસે પુસ્તકો અને every single resource is there. It's not an exam actually. It is a teaching method.
Just like a math for
They can refer to books. They can refer to online resources, articles, everything.
ફર્સ્ટ સેશનમાં તો કેવી રીતે કહી
First
શકે
session.
that time is
આ first session નથી.
PBL ની વાતમાં ફર્સ્ટ સેશનમાં તમે આટલું નાનું આપ્યું તો એ કેવી રીતે વિચારી શકવામાં આવે? એની પાસે કોઈ બેઝિક જ ના હોય.
પણ કેમ ના હોય બેસિક ઇઝ વોટ આઈ એમ સેઇંગ. થર્ડ યર સ્ટુડન્ટ ને એટલી ના ખબર હોય એબ્ડોમિનલ પેઇન એન્ડ વોમિટિંગ. આપણે સિમ્પ્ટોમેટોલોજી ને એ તો કરાયેલું જ હોય ને.
क्योंकि આપણે કોઈ પરસેપ્શન છે તો કન્ફ્યુઝ કેવું આપણે લઈ આજે એનો વિચાર હે પિક્ચર જો પૂરી સેમ જોઈએ કે એના આપણે
સમસ્યા પછી પાછો આવે.
એનાથી આપણે પ્રિપેર કરતા
સિમિલર.
અને પ્રોબ્લેમ જે હશે જે ભણી ચૂક્યો છે એ જ હશે.
આ આપણે વિક્રમનું પ્રોબ્લેમ બેઝ લર્નિંગ કર્યું.
હા.
Okay, so the tutor's role is mainly as a facilitator. Okay, I think even revised basic course માં be problem based learning and self directed learning. Self directed learning is also very important part. It it's a slightly more I won't say difficult, but કારણ કે આપણે એનાથી પહેલી વાર we have been introduced to it for the first time. We have never asked our students to do self directed learning, so I won't be able to even talk about it. Okay, students meet during the first session, then a period of 2 to 3 weeks they go and learn on their own, and finally second session they present their resolution. Okay, clear? So અત્યાર સુધી what did we see? Teaching માં હતા આપણે, teaching and assessment. આજના બે ટોપિક છે, teaching and assessment. Yes.
એડવાન્ટેજ ઓફ પ્રોબ્લેમ બેઝ લર્નિંગ.
First of all, Bloom's માં જે higher levels of knowledge જે છે ને એ achieve થઈ શકે. So ability to analyze data, ability to apply that knowledge, reason or to bring about rationale. આજે ધારો કે if you are asking someone to 28 female abdominal pain છે તો શું હોય? So then he has to work through it. કે એની જોડે વોમિટિંગ હતી કે નથી, એને ફીવર આવ્યો હતો એટલે પ્રેગ્નન્સી હોઈ શકે કે ના હોઈ શકે. So he has to work through it, and he has to work through it on his own, naturally as a group. But then કોઈક તો આવીને એમ કહે ને કે એક મિનિટ આ તો વિચાર્યું જ નહીં આપણે, આ પણ હોઈ શકે. So that is how dialogues and discussions develop. So that leads to deeper understanding of the topic rather than, and આપણે what do we compare it with? We compare it with what we are doing right now, which means lectures. Lecture લેવાની કંપેરમાં તમે જો જુઓ તો it leads to a very deeper level of Bloom's taxonomy. So basically today we are talking about teaching method and assessment method. હવે teaching method ની અંદર બે પાર્ટ હોય, એક કોગ્નિટિવ એટલે કે નોલેજનું અને બીજું સ્કિલનું. તો આપણે આ સ્કિલનું હવે ચાલુ કર્યું. ઓકે, so actually this is a session. I'll just say that I have talked about two methods. There are 1,000 methods of clinical skills teaching. Okay, I am talking about this one method, 1 minute preceptor, and the same way we will talk about Peyton's method in psychomotor skills. From બે જ મેં લીધી છે, just in order to give you an idea that newer methods are there which are more structured. Okay, so 1 minute preceptor is basically a case presentation. Fundamentally શું છે? Case presentation. Most things that you will learn in revised basic course are to a large extent it is like nomenclature. કે જે વસ્તુ તમે કરો જ છો, વર્ષોથી કરો છો, that is being given a name. Okay, now when you give something a name, it has two benefits. One is it becomes measurable, and second is it becomes replicable. Okay, so ધારો કે OMP 1 minute preceptor છે, તો કોઈ છોકરો એવું કહે કે મારું કેસ પ્રેઝન્ટેશન થઈ ગયું, મને સાહેબે કેસ પ્રેઝન્ટેશન કરાવ્યું, અને બીજો બી છોકરો કહે, તો એ બે વચ્ચે તમે કમ્પેર ના કરી શકો કે પેલાનું કદાચ 2 મિનિટમાં ઉડાડી દીધું હોય, આનો 20 મિનિટે કેસ લીધો હોય, પણ બંનેને કહેવાય શું? કેસ પ્રેઝન્ટેશન. પણ બંને જણા જો એવું કહે કે મારું OMP પતી ગયું છે, મારું OMP પતી ગયું છે, મારી લોગબુકમાં લખ્યું છે, તો it generally would mean it was the same. Okay,
preceptor નો meaning?
Preceptor is actually એટલે ટીચરનું જ વેરિયન્ટ છે, પણ preceptor is more of a facilitator એ રીતે. ઓકે, સો હું બેસિક તમને પહેલા કહી દઉં. સો 20 મિનિટનું 1 મિનિટ preceptor હોય ટેકનિકલી. હવે 20 મિનિટમાંની પહેલી 10 મિનિટ હોય ને એ સ્ટુડન્ટ પેશન્ટ જોડે કાઢે. સો પેશન્ટની હિસ્ટ્રી લે, એક્ઝામિન કરે, જે કરવું એ કરે, પછી લખી નાખે કાગળ પર. ઓકે, સો 10 મિનિટ ત્યાં જતી રહી. એ પછી પેશન્ટ જતું રહ્યું છે, હવે આપણે પેશન્ટ નથી જોવાનું. Now the student comes to us, and when he comes to us, we have these 10 minutes. Clear? પહેલી 10 મિનિટ ત્યાં હતી, આ 10 મિનિટ, આ ટોટલ 20 મિનિટ. હવે આ જે 10 મિનિટ છે એમાં 5 વસ્તુઓ થશે. ઓકે, 5 વસ્તુઓ મતલબ એમાંની પહેલી 3 કે 4 મિનિટમાં એ છોકરો હિસ્ટ્રી બોલી જશે. ઓકે, હવે આ હિસ્ટ્રી આપણે જે કહીએ જેવી ના હોય, પણ એકદમ સ્પેસિફિક હોય. That you know, Mr. So and so presented to us with acute abdominal pain, or 50-year-old male who's a Hindu. But ekdam fast case summary જેવું બોલશે. Okay, now when he says the summary, એ બોલી લીધું, પહેલી 10 મિનિટ ત્યાં ગઈ, 2 કે 3 મિનિટ બોલવામાં ગઈ, હવે આ 7 મિનિટ બચી, એમાં આ બધું કરવાનું છે. Okay, so what is the first thing you will do? So you will ask for commitment. કમિટમેન્ટ મતલબ તું બોલ, તને શું લાગે છે? આપણે પૂછીએ છીએ ને, ડોન્ટ વી ડુ ધીસ? વી ડુ ધીસ એવરી ડે. વોટ ડુ યુ થિંક? યસ, વોટ ઇઝ યોર પ્રોબેબલ ડાયગ્નોસિસ? વોટ ડુ યુ થિંક ધ પેશન્ટ હેઝ? એટલે એ કહેશે કે મને એવું લાગે છે. હવે વોટ હી હેઝ ટુ ડુ ઇઝ હી હેઝ ટુ કમિટ વન ડાયગ્નોસિસ. ધીસ ઇઝ ઇમ્પોર્ટન્ટ. એણે એક ડાયગ્નોસિસ કહેવું. ઓર ગુડ આફ્ટરનૂન સર.
Happy birthday.
Happy birthday.
Happy birthday.
અમે સાહેબ ઊંધું કહેતા હતા, સાહેબ આવશે, કેક કટિંગ કરીશું અને એન્જોય કરીશું, પછી છૂટા પડીશું.
આમાં એવિડન્સ બધો રેડી થઈ
બધા સવાલ પૂછું છું.
રેકોર્ડિંગ
Okay, so the first step is to ask for commitment, and this is something that we don't do. Okay, we instead start to teach. Instead you will ask for commitment. Now ideally he has to come with one, at the most second. બે જણે ડાયગ્નોસિસ કર્યા, ધારો કે એવું હોય કે ભાઈ this so and so male and he has right lower abdominal pain and this and that. What do you think he has? And then he says that I think he has acute appendicitis, but maybe he can have ureteric colic, right? Something of that sort. So then the step 2. Second step is probe for supporting evidence, which means why do you think so? તને કેમ એવું લાગે? So he has to then say કે ભાઈ યંગ મેલ છે, પહેલો અટેક છે, RIF માં ટેન્ડરનેસ છે, ફીવરનો એક છે, સેડ એમ તો એનોરેક્સિયા બી હતું, અને પેઇન બેરેબલ હતું, something of that sort. So that is probe for supporting evidence. Now after step 1 the student will speak. After step 2 the student will speak. એ પછી 3, 4 અને 5 આપણે સ્ટ્રોંગ બોલવાનું છે. So we will have to ensure કે આપણે એ ફ્લો સાચવીએ. The first thing is teach general rules. So what are general rules? So consider that you would tell them that generally speaking આપણી પાસે ધારો કે કોઈ ફિમેલ પેશન્ટ છે ને, ફિમેલ પેશન્ટ આપણી પાસે લોઅર એબ્ડોમિનલ પેઇન લઈને આવી છે, યંગ ફિમેલ છે, ફર્ટાઇલ છે, અને અક્યુટ પેઇન છે, શી ઇઝ નોટ વેલ, તો આપણે એટલીસ્ટ એક્ટોપિક પ્રેગ્નન્સી તો વિચારવું પડે. નાઉ ધેટ ઇઝ યોર કી મેસેજ ફોર ધેટ કેસ. So it is said that those general rules or that one thing that you want to teach can be taught in 1 minute, and that is why the name of this process is known as 1 minute preceptor. You are teaching some general rule, one thing that he will almost always remember. કે ના ભાઈ મારી પાસે બ્રેસ્ટ લમ્પ સાથે પેશન્ટ આવ્યું, બોર્ડરલાઇન એજ ગ્રુપ છે, મારે મેલિગન્સી રૂલ આઉટ કરવી જ પડે. So that means that one thing goes to him. That is where you teach general rules. So first you ask एक diagnosis बोल, કેમ તને એવું લાગે છે? Then you start teaching general rules. Then you tell him what he did right. That right, you ask for history of fever, you ask for history of anorexia, that was good, right? And finally you ask him to correct mistakes. Okay, what did he lack? કંઈ પણ એવું હતું કે જે વધારે સારું થઈ શક્યું? And then you can in the end also tell him that you can pick up this topic for self-directed learning. Okay, so this is known as 1 minute preceptor. Okay, આપણે આ જ કરીએ છીએ, હું ફરીથી કહું છું, we do the same thing.
એક્ઝામ્પલ લોંગ કેસ પૂછીએ.
Actually, this is very short actually, so we don't call it long case. But main is that બે જણા એ છે હેતુ. Number one, it is replicable, measurable. Secondly, it also goes to prove that even in a busy OPD, you can at least do this with 1 or 2 students. Okay. SNAPS is similar. SNAPS is an acronym for same thing, but SNAPS is a slightly higher level of case presentation, and it is usually learners driven. એટલે કે તમારો સ્ટુડન્ટ અહીં એવું કહે કે સર મેં એક કેસ પ્રેઝન્ટ કર્યો છે, મારે સ્નેપ્સ કરવાનું તમારે something of that sort. So first step is summarize the case, the same. Narrow the differentials, કે મને એવું લાગે છે કે આ 2 કે 3 વસ્તુ હોઈ શકે. Analyze the differential, કેમ એવું લાગે છે. Finally probe the preceptor. Now this part, probe the preceptor about the uncertainties. This is unique to SNAPS. Okay, this is where the learner is probing the preceptor. So he is asking the preceptor, મારે કંઈ મોટો લોચો વાગ્યો છે, કોઈ એવું કંઈક છે કે જે હું ચૂકી ગયો છું totally? Do you get it? Is there some other point of view that I have completely missed out? Right? So this is very unique about SNAPS, which gives the learner an opportunity to ask the preceptor. Finally, he will also talk about planning the management, and he will select a case for self-directed learning. Like if you see here, the preceptor is not talking much, whereas in OMP the preceptor has a large role to play. So I told you that clinical skills માં 2 પાર્ટ આવશે, એક કોગ્નિટિવ પાર્ટ કે જે આપણે આ જોયું, અને હવે સાયકોમોટર સ્કિલ્સ. એમાં પેટર્ન્સ 4 સ્ટેપ મોડલ છે. પેટર્ન એટલું યાદ રાખશો તો ચાલશે. what it is I will just tell you. So first part is કે ધારો કે you want to teach psychomotor skill માં, you want to teach how to draw blood. Okay, so you can teach it in 4 steps. The first step is known as demonstration. So the instructor, like an instructor, if I am the instructor, then the instructor demonstrates that skill at normal speed. Normal જાણે જેમ બ્લડ ખેંચતો હોય રીતે કરી લો. આપણે એવું માનવાનું છે કે we are talking about a very high fundu kind of a mannequin. Okay, we are not talking about patient drawing blood. So the instructor demonstrates the skill at normal speed, and there is no narration. So I am not speaking anything. હું જસ્ટ ફટફટ કરી અને મૂકી દઉં છું. આ પહેલું સ્ટેપ છે, which is demonstration. Second step is deconstruction. So instructor only demonstrates this same વસ્તુ, but slower speed and narrating every step. દરેક સ્ટેપ પર બોલવાનું કે what will I do? I'll first take consent, then I'm disinfecting my hands, then I'm taking a swab, I'm cleaning the area, I'm readying the syringe or vacutainer, right? Labeling the vacutainer, whatever. એટલે એ સ્ટેપ્સ નક્કી હોય અને એ ધીમેથી બોલે અને બોલતા બોલતા કરે. Third step is formulation. The instructor again demonstrates the skill, but now what is happening is that the student will talk him through. First you explain the procedure, so I will explain the procedure. Then the student will tell me, and now you clean your hands, so then I will sterilize my hands. Then now you please prepare the area, then I will do it. So this is formulation. I am doing only what he says. Now if there is a major deviation, then I will tell him, do you think તું કંઈક ભૂલી ગયો છે અહીંયા? Then he can, oh yes, I forgot. Okay, so you can, it is not very straight jacket. તમે એને કહી શકો કે ભાઈ તું આ મેજર વસ્તુ ભૂલી ગયો, right? So that is formulation. And final is performance, where the student demonstrates the skill while describing each step. So 3 times instructor does it, and 4th time the students does it. Now this is usually 1-to-1. In a batch of 250, the question always arises that how will you do it, even if you have 30 students. So that is why there is something known as modified patterns method. Okay, so what is done is once those steps are very clear, then if you do it with one student,
પ્રીવિયસ સ્લાઇડ ખાલી જસ્ટ પૂછ્યું છે તો જે ડીકન્સ્ટ્રક્શન છે એ નેમ એક્ઝેક્ટલી જાય છે ડીકન્સ્ટ્રક્શન કે ઇટ ઇઝ અ રીકન્સ્ટ્રક્શન
deconstruction.
Construction in steps, divided
Construction
steps.
is divided into that.
Construction is divided. Deconstruction.
ઓકે એ રીતે
It is deconstructed. એ રીતે. એટલે કારણ કે આટલા બધા સ્ટુડન્ટ્સે કઈ રીતે કરવાના, so that is why they came up with something known as modification. આ બધા જ સ્ટેપ કરવાના. પાંચમો સ્ટેપ એવું કે હવે એક સ્ટુડન્ટ બીજા સ્ટુડન્ટને કરાવે, પણ એના માટે શું નક્કી હોવું જોઈએ કે ભાઈ ધારો કે if we want to teach drawing blood, તો ડ્રોઈંગ બ્લડના સ્ટેપ્સ ડિપાર્ટમેન્ટ લેવલે નક્કી થઈને પ્રિન્ટેડ હોય કે ભાઈ આજે મારે પેટર્ન કરાવવાનું છે, 15 સ્ટુડન્ટને કરાવવાનું છે, તો આ જ રીતે એક્ઝેક્ટલી કરાવવાનું છે. Here, got? So that step is known as circulation. Okay, one student teaches another, they undergo the same exact course and they also provide peer feedback. Clear? અત્યાર સુધી ટીચિંગનો પાર્ટ હતો, એમાં બે પાર્ટ હતા, કોગ્નિટિવ અને સાયકોમોટર. એટલે આપણે નોલેજનું ટીચિંગ ભણ્યા, એમાં લાર્જ ગ્રુપ, સ્મોલ ગ્રુપ. લાર્જ ગ્રુપમાં લેક્ચરની અંદર ત્રણ વસ્તુ મેં કીધી હતી, એક થિંક પેર શેર અને બીજું બસ ગ્રુપ, અને લખવાની બે મેથડ કીધી હતી, એમાં એક મોડિયસ પોઈન્ટ અને બીજું 3 મિનિટ સમરી. તો એ લાર્જ ગ્રુપ હતું. સ્મોલ ગ્રુપમાં બહુ બધી આપણે વાતો કરી. ઇન્ડિવિજ્યુઅલ અથવા ઇનોવેટિવ મેથડમાં એક સ્પેસિફિક હતી પીબીએલ. સો ધીસ વોઝ અબાઉટ થિયરી ટીચિંગ. ક્લિનિકલ સ્કિલ્સ ટીચિંગમાં ક્લિનિકલ સ્કિલ્સ અને પ્રેક્ટિકલ સ્કિલ્સ. ક્લિનિકલની અંદર ઓએમપી જોયું અને સ્નેપ્સ જોયું, અને પ્રેક્ટિકલમાં પેટર્ન્સ જોયું. આ ટીચિંગનો પાર્ટ પત્યો. હવે વી આર ગોઈંગ ટુ ટોક અબાઉટ અસેસમેન્ટ. એટલે આપણે આ ત્રણ
પેટર્નમાં જે
વસ્તુ,
પાંચમો પોઈન્ટ કીધું ને સર્ક્યુલેશન,
હા.
એમાં એક સ્ટુડન્ટ બીજા સ્ટુડન્ટને શીખવાડે, પછી એ પિયર ફીડબેક આપે, એટલે
પિયર ફીડબેક એટલે એ જ એને કહે કે તારી આ ભૂલ થઈ ગઈ.
સ્ટુડન્ટ ટીચરને
ના,
બીજા
Internally, peer એટલે internal.
એટલે પેલો સ્ટુડન્ટ એટલો એક્સપર્ટ થઈ ગયો એટલી વારમાં કે
એટલે યુ આર રાઈટ. એટલે એમાં એવું કહેવાય છે,
જે લખેલું સ્ટેપ નથી કર્યું ને એ મિસ્ટેક બધા, જે લખેલું છે એ નથી.
એમાં એવું કહેવાય છે કે એ જે તમારી ના, ના, તમારી પાસે જો મેન્યુઅલ તૈયાર હોય ને તો હી કેન રીડ એન્ડ
ઓકે
ધેટ ઇઝ ધ રીઝન વાય ઇટ ઇઝ ઇમ્પોર્ટન્ટ ટુ ચાર્ટ ઇટ આઉટ, અને જેટલું ડિટેલમાં કરાય.
આઈડિયલી આપણે જે એનાટોમીમાં ડિસેક્શન કરતા હતા ત્યારે ઘણીવાર એક સ્ટુડન્ટને મેડમ શીખવાડે, પછી એ ડિસેક્શન કરીને બીજા લોકોને શીખવાડે.
Perfect.
આપણે નોટ મારતા શીખો પહેલા આપણે બોલીએ નોટ આવી રીતના મારવાની, પછી બીજી વાર આપણે એને ડિસ્ક્રાઇબ કરતા કરીએ, ત્રીજી વખત એને જો આ ટેકનિક કરીએ, ચોથી વાર શું પરફોર્મ જાતે કરે.
એ ખબર કે પાંચમું peer feedback
થઈ ગયા.
I think formulation is something new where the student walks you through each step. That is something that we
ત્રણ
do.
વસ્તુ નવી આવી કે હું તમને કહું છું તમે એ પ્રમાણે
કરો.
કરો. That is new.
એટલે એક પેટર્નમાં 3 વાર તો ઇન્સ્ટ્રક્ટર જ પરફોર્મ કરવાનું છે, ખાલી એક જ વાર સ્ટુડન્ટે પરફોર્મ કરવાનું. ઓકે, સો આપણે આ તો ગઈ વખતે જોયું હતું, TLMs અત્યારે જોયું. નાઉ વી આર ગોઈંગ ટુ અસેસમેન્ટ. So assessment is to provide a value judgment, and it refers to any formal or purported action to obtain information about competence. We all know. I will reiterate this thing because it's very common to use these two terms interchangeably. So please know that assessment is always that of a student. Assessment is of student, evaluation is of a program. Okay? હવે પ્રોગ્રામનું ઇવેલ્યુએશન કરવાનું હોય, એના 5 પેરામીટર નક્કી કરો, એમાં સ્ટુડન્ટ પરફોર્મન્સ તો આવવાનું જ છે. એટલે એસેસમેન્ટ
It's a part of evaluation.
part of evaluation, but evaluation is of program. So do not use these terms interchangeably. So current methods we all know that એક જ ફાઇનલ હોય, પાસ કે ફેલ છે, અને રેગ્યુલારિટી વત્તા આપણે જે ટિપિકલ કહીએ છીએ, કોઈ છોકરો વોર્ડમાં રેગ્યુલર આવતો તો કોઈ બેચ હોય 30 જણની, એમાંના 4 જણા એમથું હોય કે જે લોકો કેસ પ્રેઝન્ટ કરે રાખતા હોય, તો એને છેલ્લે કોઈ બેનિફિટ નથી થતો. અત્યારે થાય છે કશો બેનિફિટ? ધારો કોઈ છોકરાઓ આપણા એવા હોય કે જે સામે ચાલીને એવું કહે કે સર મારે સેમિનાર કરવો છે, કે મારે અમે ગ્રુપ ડિસ્કશન કરીએ, એનો કોઈ પણ અત્યારે એના ફાઇનલ એક્ઝામ પર કોઈ પણ બેનિફિટ છે નથી. સો ધીઝ આર શોર્ટકમિંગ્સ ઓફ અવર કરંટ મેથડ્સ. Plus communication skills, professionalism, these things which we as such give huge importance to. But is it ever measured?
No.
Never, right? And most fundamentally, there is no feedback. Okay, so then why should we assess? Of course, you need pass or fail judgment. We also need to identify areas that need improvement, of course, for entrance test and program evaluation. As I told you, it is also part of evaluation, program evaluation. Okay, anybody can tell me what is internal assessment? અત્યારે તમને ઇન્ટરનલ અસેસમેન્ટ એવું કોઈ કહે તો વોટ ડઝ ઇટ મીન ટુ યુ?
ડે ટુ ડે એક્ટિવિટી, ડે ટુ ડે માં
5 ઇન્ટરનલ નથી લેતા એનું
Self
ના, ઇન્ટરનલ અસેસમેન્ટ સેલ્ફ અસેસમેન્ટ બધી નથી આપતી.
સામે લર્નર
It is very logical path.
લર્નર નું ઇન્ટરનલ
asking each and every member
ડે ટુ ડે
about the
એક્ટિવિટી માં એનું એસેસમેન્ટ
benefits and
રેગ્યુલર બેઝ
shortcomings
ઉપર.
of the program.
એટલે પેલી કેટેગરી સિસ્ટમ છે
ત્યારે ઓફ ધ પ્રોગ્રામ નહીં, આપણે તો એસેસમેન્ટ ની વાત કરીએ.
કેટેગરી સિસ્ટમ નથી હોતી. ધેટ ઇઝ એન ઇન્ટરનલ એસેસમેન્ટ એવરી યર પરફોર્મન્સ ઓન ધ બેસિસ ઓફ ધીસ ગ્રુપ કે આટલા તમારું જે ગ્રેડિંગ સિસ્ટમ ગણો કે
Each and every assessment.
અત્યારે ઇન્ટરનલ અસેસમેન્ટ એટલે શું? વોર્ડ એન્ડિંગ એક્ઝામ, બરોબર.
પછી આ ફર્સ્ટ ઇન્ટરનલ ને
પ્રિલિમ
આપણે જે થિયરી લઈએ છીએ, ધેટ ઇઝ અવર ઇન્ટરનલ અસેસમેન્ટ. ક્લિયર?
પ્રિલિમ ના પેલા ક્લિનિક ના પેલા કેસીસ ના જે લઈએ.
So basically that is what we say as internal assessment. So this is also known as curriculum embedded assessment. કારણ કે એ કરિક્યુલમના જ પાર્ટ તરીકે છે, એ એન્ડમાં નથી, કરિક્યુલમ પોતે પછી નથી, એની વચ્ચે છે. It assesses the students while they are still in the classroom. Usually there are less time limitations as compared to external assessment and બીજા constraints ના હોય. Teachers can also get data driven feedback. I mean, if we truly see, so internal assessment also is an assessment of the teaching. So it also tells us, ધારો કે આપણે 50 પેપર ચેક કરીએ અને 50 પેપરમાં એવું લાગે કે ભાઈ in 40 papers, question papers, this particular question nobody was able to answer, then we know that probably this should not have been asked, okay, or whether it had any relevance or not. So it gives us a data to evaluate our own self, and finally students come upon feedback which helps them. Now there is no feedback, okay, currently we are talking about what are the things to come, what's going to happen in times to come. So internal assessments, આપણે માનીએ કે written assessment is the only thing, પણ હવે જે આવી રહ્યું છે એમાં ચેકલિસ્ટ હોઈ શકે, જર્નલ્સ હોઈ શકે, સ્ટુડન્ટ્સ કેન મેન્ટેન જર્નલ, log books which students are going to maintain, and portfolio. Portfolio અને log book નો ફેર ખબર છે કોઈને? Does anybody know what is the difference between
Portfolio includes all these things: checklist, journal and log.
Yes. Anything else?
પોતે જે પેલો બનાવેલા હોય થિયરી ને
So
નોટ્સ
basic-
બધી બનાવેલી હોય એ પણ એમાં ઇન્ક્લુડ
Notes ના એ લોકો include કરે,
જે પણ.
પણ anything that you can say is a sort of an achievement or a test that they can put. Consider that they took part in drama in cultural festival, then they can put in that.
લોગ પ્લસ એના સર્ટિફિકેશન અને એમના અચીવમેન્ટ્સ અને
Yes. So logbook is part of portfolio, but portfolio is a very large document. Yes. In class work. Okay, so in class work is how are they acting in the class? ધારો કે નોટ્સ કોઈએ લખી હોય તો એમાં એ લોકો કયા ઇમ્પોર્ટન્ટ પોઈન્ટ લખી રહ્યા છે વગેરે. So none of this is happening right now. Okay, zero. આમાંનું કંઈ આપણા માટે internal assessment એટલે what we had identified, that we take 2 tests, 1 prelim and ward ending. Any idea what is summative assessment and what is formative assessment?
એ હા હતું.
સ્કૂલમાં આપતું હતું છોકરાઓમાં.
નહીં, summative
હા, પણ એનો મતલબ શું? What does it mean?
અઘરી વસ્તુમાં.
ના, કશું અઘરું નથી, એમાં શું અઘરું? Even if you just go with the words, then you will know. નીતિનભાઈ?
ફોર્મેટ
એટલે તમે જનરલી કહી દો કે આ છોકરો બહુ સારો
એક મિનિટ.
During the tenure we are assessing.
During the tenure that you assess, that would be what?
Summative is
That
the
is
sum
formative.
of everything. Sum of
Summative at the
everything,
end of-
everyone.
Summative is at the end of it. Anybody wants to differ? Yes.
બંને ટેન્યોરમાં જ થાય. પેલામાં તમે પહેલેથી ફોર્મેટ બનાવ્યું હોય એ પ્રમાણે માર્ક મૂકો એટલે ફોર્મેટિવ.
ફોર્મેટમાં બનાવ્યું એ પ્રમાણે હોય. Okay.
સમેટિવ એટલે તમે જનરલી કહો કે વિક્રમ સારો એપી છે, ધેટ ઇઝ સમેટિવ. કોઈ પણ ફોર્મેટ બનાવ્યા હોય.
Okay. Okay.
જે આ
So
જયેશભાઈ સારા એ જોયું છે બસ એ રીતે.
perfect. Okay. So I would reiterate at this point that internal assessment, if you think there are some key elements that have been given huge focus, huge importance in CBME 2019, that is CBME, then one of them is internal assessment and second is formative assessment. Okay, so formative assessment is non-existent in our colleges and formative assessment ઉપર ખૂબ ભાર આપવામાં આવ્યો છે. So the way I told you earlier, self-directed learning is one important thing for CBME. Problem-based learning is important. Electives are something, foundation course. The same way, formative assessment has been given huge importance, okay? And we will see why so. So summative assessment is a final value judgment. Chilla mark, puru. Ema koi fair na thai શકે. And it is assessment of learning. Assessment of learning. Formative assessment is an ongoing assessment, and it is assessment for learning. Okay? Clear thai jase sehjવાનું. So if you see what is formative versus summative, so consider you have this plant. You see it, oh, it looks very dry, let me water it. And you water it. So what you are doing is, your purpose is to improve the quality of the plant. And what happens in summative is, too short, not tall, too short and not enough leaves, grade C. Your purpose is to judge the quality. So the main aim in formative assessment is to improve. Main aim in summative assessment is to judge. Yeah.
ઇન્ટરનલ જે વીકલી એક્ઝામિનેશન્સ ને બધું જે લેવાય છે અને એના બેઝ પર જ્યાં અટકો છો ત્યાં ફરી
So,
લેક્ચર લેવાય છે
બધા જ answer
that is
rates.
what formative and summative is
Everything
final
will be
exam
answered.
એવું.
Everything will be answered. Because there is a lot of confusion around what is internal versus external and what is formative versus summative. And the common question is internal assessment of formative assessment? એવો પણ પ્રશ્ન છે. Okay? So formative, it's a range of formal and informal assessments. Please mark this, formal and informal assessments. અહીંયા મૂકી દો. મૂક. Procedures which are conducted by the teacher during the learning process in order to modify teaching and learning activities. Not only કે પેલાને શું કરવાનું, મારે શું ચેન્જ કરવાના છે to improve student attainment. Okay? બે કે ત્રણ વસ્તુ ઇમ્પોર્ટન્ટ છે. ફોર્મલ બી હોઈ શકે, ઇનફોર્મલ બી હોઈ શકે. It is during the learning process in order to modify teaching. So formal variety માં શું હોય? Written document, test લીધી, quiz લીધી, અથવા કોઈ પેપર કાઢ્યું. Okay? It is usually given a score or a grade. અને એ તમે વાપરવાના છો તમારા ફાઇનલ સમેટિવ એસેસમેન્ટમાં. મતલબ કે આના માર્ક ગણાય છે. ઇટ ઇઝ અ ફોર્મેટિવ એસેસમેન્ટ, ફોર્મલ વેરાયટી. બે વેરાયટી હોય, ફોર્મલ અને ઇનફોર્મલ. ક્વિઝ લીધી, ટેસ્ટ ક્વિઝ કંઈ પણ લીધું. યસ.
કે ચાઇલ્ડ હોય ને સ્કૂલમાં જે ટેસ્ટ લેવાય છે ને એ લોકો F1 F2 F3
That is formative.
That is formative. There the confusion lies where. Okay, so એ બી ક્લિયર થઈ જશે કે એને કેમ ફોર્મેટિવ કહે છે. Informal variety usually may not contribute to a grade. Okay, so internal variety, informal kind of assessment શું હોય? તો તમે એમને જ કોઈને સવાલો પૂછ્યા, તમે એમને જ impromptu test લીધી, રિટર્ન નથી,
vocabulary check કરે,
એમ જ કંઈ પણ ફટાફટ કરી દીધું. So that is during the round પૂછ્યું, છોકરાઓ ઓપીડીમાં આવ્યા છે ત્યારે પૂછી લીધું. So that is all informal formative assessment. Okay? હવે ધારો કે હું તમને એક જ શબ્દમાં કહું, if I tell you in just one word or rather one sentence, that how do you differentiate between what is formative and what is summative? So there's just one difference. If you are providing feedback at the end of that assessment, it is formative assessment.
Perfect.
Learner provide the feedback. The
teacher,
Okay.
preceptor.
Okay. So that prelim that we take for postgrads, and then we do not meet here and discuss. We meet here and discuss. That means it is a formative assessment.
Audit type.
Let's talk. Keep it the same word feedback. Okay. કોઈ વર્ડ્સમાં મેસ અરાઉન્ડ નહીં કરવાનું. ઓકે. સો ધારો કે આપણે એ કંઈ ના કરતા હો અને આપણે એમને જ આપી દેતા હોય, છોકરાઓને તારા આટલા માર્ક આવ્યા, તારા આટલા આવ્યા. So then it would be a summative assessment. Okay. Now, second important part is કે આપણે અત્યારે, if we see, we do take term ending exams, we take prelims, we take internal written theory exams. Do we provide feedback?
No. So that is not formative.
So that is not formative. And it also is counted in there.
So
Final.
though it should be the feedback oriented, still we are not giving feedback. That is why it is not formative.
Fine. So now what are we doing? We are
નહીં,
What are we doing? We are judging the quality of students.
True.
At the end of that exam, he doesn't know કે મારો લોચો કેમ વાગ્યો હતો.
એક્ઝામ પછી પેપર બચવા માટે બોલાવવાના
Immediately બોલાવાના.
any evaluation with feedback, that is formative.
Any assessment with
feedback.
Yes.
માર્ક્સની બાજુમાં ખાલી લખો કે ગુડ, વેરી ગુડ, એક્સિલન્ટ.
Cam.
That is not feedback.
That is not feedback. Cam. You have to identify, tell them cam.
Why
કારણ કે
you
જે
write down
ખાલી
result
good હશે
for
એને
good?
વધારે તમારે ફોર્મેટ વધારે તમારી improve કરવા માટે style
description
કરવાનું.
થઈ ગયું ગુડ વેરી ગુડ એ સમેશન નું ડિસ્ક્રિપ્શન થઈ ગયું.
Yes. So basically, if your assessment plus feedback is formative. Assessment without feedback is summative.
Summative. બસ આ ટૂંક છે એનું.
બરોબર? એટલે we have to
પડતી પ્રશ્ન.
ફરી. એક મિનિટ. સ્માર્ટ ભાઈ.
CR માર્ચ મહિનામાં CR ભરવાનો. હવે PR ભરવાનું ચાલુ થયું.
Ravi will take a break.
so just remember these two things. Okay? હવે internal versus external. So very simple. જ્યાં સુધી till the time you have an external examiner from other universities, external. Everything else is internal. Now internal can be formative or it can be summative.
Okay.
આપણે જેટલી પરીક્ષાઓ લઈએ એ પછી સ્ટુડન્ટ્સને બોલાવીને સમજાવીએ કે ભાઈ લે આ તારું પેપર હું ખોલું, ચલ જો આન્સર પેપર જો 15 માર્કનો સવાલ છે મેં કેમ 12 આપ્યા તો આને લીધે આપ્યા, તને કેમ 5 આપ્યા તો આને લીધે આપ્યા.
That is very useful, formative assessment.
It is not useful, it is the thing.
Compulsory.
મારો માઇક્રોબાયોલોજી પેપર બતાડેલું તારે મને ખબર પડી આખો જવાબ સાચો લખ્યો તો આને 12 માંથી 2.5 માર્ક આપેલા કારણ કે મારા વે ઓફ પ્રેઝન્ટેશન ખાલી ખરાબ હતું. Then I improved.
Yeah, so that is the whole. So then you improve. So that is why the goal was what? The goal was to improve.
Yes.
So that is why it is formative. Now how do we switch to formative assessment?
ભાષામાં કે ભાઈ મારી ભૂલો શોધી આપો તો ઇમ્પ્રૂવ થઈ જશે એ પ્રમાણે છે.
We can always have our own meaning of it, but I would ask you not to mess around with the words.
Yes.
Okay? Assessment means assessment, formative means with feedback. It is for growth, not judging the growth. Okay? Clear? Okay?
Clear. આ એક વસ્તુ ક્લિયર થઈ.
So what are the attributes of the assessment? Now, no, I will not go in details because validity can be internal or external. There can be construct validity, there can be content validity.
Not achievable. Ideally.
The point is, any assessment always has these 5 things. Okay? અને એવું કહેવાય કે આ 5નો ગુણાકાર, what does it mean? The product of this 5 is known as assessment. No, there's a particular word which I have forgotten. So the idea is that none of this can be 0, because if it is 0, then the product is 0.
Because that is multiplication.
Product, I said
Product, yeah.
product is multiplication. Okay, so out of this validity no matlab શું થાય?
જે એક્ઝામિનર
Acceptable to everywhere.
એસોસિએટ પ્રોફેસર હોવા જોઈએ.
Method of measurement is accurate.
Is the things which can be
Very
help
good.
to distinguish between the two.
Okay, so
I think validity એટલે એક્ઝામિનર એસોસિએટ પ્રોફેસર આવે.
validity means it measures what it says it will measure. Okay, reliability means બે એક્ઝામિનરની વચ્ચે ચેન્જ થશે ને તો પણ એ તો કામ કરી આપશે.
It
That
is
is
acceptable true for everywhere.
feasibility is feasibility like ભાઈ if I am saying કે હું કંઈક સ્કિલ લેબમાં કરીશ પણ સ્કિલ લેબ જ ના હોય તો એટલે feasibility is infrastructure related. Acceptability is department અને એમાં feasibility નો પાર્ટ આવે અને educational impact is long run કે તમે આજે આ assessment કર્યું એને લીધે જે છોકરો પાસ થયો એ જે પાસ થયો કે 200 છોકરા પાસ થાય એને લીધે સમાજ પર શું અસર થઈ. Okay, so educational impact can be huge. It can be at the level of society, state, country, even world. Okay, fine. Miller's pyramid છે. Actually, Miller, Professor Miller, George Miller, he has આ જે particular article છે. Can you please be here, please? આ જે આર્ટિકલ જે છે ઇટ્સ અ ટ્રીમેન્ડસ આર્ટિકલ ઓન અસેસમેન્ટ અને સો ઇફ યુ સી જો તમારે નોઝ લેવલ જોવું છે તો શેનાથી પૂછી શકાશે સો યુ કેન જસ્ટ આસ્ક MCQs ખાલી enumerate this knowledge only recall knows how slightly more application level then how do you assess that so you can ask through case presentation you can ask through essay questions or extended matching MCQs matlab that the questions will be slightly deeper so this is cognition પણ હવે આવશે આ behavior એટલે કે psychomotor તો એમાં if you are still at the level of shows so you can go for skill lab or if you think this is something that he must know history taking है तो history taking तो real life में આવડવું જ જોઈએ compulsory मतलब કે એ તો એને performance ના લેવલે ડસ ના લેવલે કરવાનું છે તો એ ક્યાં કરવાનું આપણે વર્કપ્લેસ બેઝડ मतलब કે રિયલ પેશન્ટ્સ સાથે આ જે બે જે છે એમાં ફેર એટલો જ છે કે જે શોઝ લેવલ હોય ને એ તમે સ્કિલ લેબમાં કરી શકો ડસ લેવલ હોય ને એ વર્કપ્લેસ પર કરવું પડે સ્કિલ લેબનો મતલબ વિધાઉટ એક્ચ્યુઅલ પેશન્ટ અને રિયલ વર્કપ્લેસ નો મતલબ વિથ એક્ચ્યુઅલ પેશન્ટ I have skipped this part okay આ તો ખાલી આવશે તમારે એટલે ખાલી કહું છું કે એસે ક્વેશ્ચન્સ ના પણ પ્રકાર હોય છે એ કઈ રીતે સારા બનાવવાના that is also taught short answer question and MCQ how to create one so that is also there our final part is assessment of clinical and practical skills so we saw two things teaching and assessment teaching માં we saw knowledge જેમાં we saw three methods large group small group અને problem innovative methods ક્લિનિકલ સ્કિલ્સ ટીચિંગ હતું એમાં બે પાર્ટ જોયા એક ક્લિનિકલ માટે OMP 1 મિનિટ પ્રિસેપ્ટર જોયું અને પેલા માટે પેટર્ન જોયું એ આખું ટીચિંગનો પાર્ટ પત્યો દેન વી સ્ટાર્ટેડ વિથ અસેસમેન્ટ તો અસેસમેન્ટમાં અત્યાર સુધી જોયું એક કોગ્નિટિવ વસ્તુ જોઈ નોલેજના લેવલે હવે વી આર લુકિંગ એટ હાઉ ટુ અસેસ ક્લિનિકલ ઓર પ્રેક્ટિકલ સ્કિલ્સ આમાં વી વિલ ટોક અબાઉટ ઓનલી two things okay so CBME has teaching and assessment has of knowledge and assessment of skills skill assessment can be workplace based or it can be others so workplace based assessment હોય એમાં મિની CEX આવે અને procedural હોય એમાં directly observed procedure station આવે okay so
What is mini CEX?
એટલે મને ખબર જ હતું કે આવશે એટલા માટે હું પ્રિન્ટ આઉટ બી લઈને આવ્યો છું so we will see this અને OSCE હું અત્યારે સ્કીપ કરી દઈશ okay so let us
સાંભળી બોલી જાય ને પછી યાર
સાથે સાથે મેં બહુ શોર્ટ રાખ્યું છે
જ્યારે એક જ રાખવાની આ ફોર્મેટિવ એસેસમેન્ટ છે પત્યા પછી ફીડબેક
સેક્સ
okay so mini CEX okay so CEX stands for clinical evaluation exercise you can say that roughly CEX that is clinical evaluation exercise would parallel our long case so CEX જે છે એ લગભગ આપણે long case જેવું હતું so then they came up with this is actually created by American Board of Internal Medicine Physician ABIM દ્વારા કર્યું so they came up with something known as mini CEX એટલે સાદી ભાષામાં જો પેલો long case હતો તો આ કદાચ short case હતો okay so it stands for mini clinical evaluation exercise it is a modification of traditional bedside oral examination the student meets real patient okay this is workplace based assessment એટલે કે પેશન્ટ સાચું હોય આપણે સાઇમ્યુલેશનમાં નથી કરવાનું ઓકે ડઝના લેવલે કરેક્ટ a skilled clinician educator can judge or even a resident who has been trained he can as well judge okay and takes about 10 to 20 minutes strengths are of course that it tests trainees performance with real patients assessor is a clinician educator so he can also judge and provide feedback and that is why it is also a form of formative assessment and trainees are presented with complete and realistic clinical challenge કારણ કે real patient જ બેઠું છે એની જોડે સાચી જ વાતો કરવાની right weaknesses are a single encounter
DNB એક્ઝામમાં બોર્ડ રાઉન્ડ લેવાય છે it is
let's just first finish this then you will know whether it is the same or not so single encounter is not sufficient એટલે એક જ સ્ટુડન્ટનું એકવાર મિની CEX કર્યું તો ઇનફ થઈ ગયું એવું ના હોય need more encounters with varying scenarios that means varying kind of patient and different assessors So the assessor એટલે આપણે કે teacher A. Some degree of difference also exists between assessors for the same case. Okay. It does not represent real world challenges like time constraint. Okay. So why આ બધા weaknesses કેમ છે હવે આપણે જોઈએ એટલે idea આવશે. Okay. So you have this form?
Yes, sir.
Okay. So so what will happen in mini CEX is, please get this thing clear. You are not talking with the student. Okay? The student is talking with the patient. For those 10 to 20 or 15 minutes, you are only observing. Clear? Khali ne khali observe karwanu. So there is no question answer between you and the student.
USMLE part 3.
MLE.
MLE part 3.
તમારો approach patient માટે કેવો છે, that is assessment, આપો assessment.
Right. Okay. So this form that you have, if you see here on the screen, it has 3 parts. Okay. અને પહેલો part જે highlight કરેલો છે. So what will happen is, you will write your name, that is the evaluator, which was the date, what was the name of the doctor, what was the problem tentatively, કયા સેટિંગમાં થયું હતું, પેશન્ટની ડિટેલ્સ સાથે બધું. Now you really want to know one thing, that this first part is very malleable. એ બહુ મેટર નથી કરતું. Mini CEX form has been translated in more than 30 languages across the globe. દરેક ઘણી બધી હોસ્પિટલો પોતાના લેવલે આ બધું બદલે બી ખરી, that is okay. જે core છે, which is this second part, 1 through 7, if you will see in your form, you will. So for each encounter that you observe, you have to rate that student for these 7 things. Okay, so what is the first thing? Medical interviewing skill, physical examination skill, humanistic or professionalism, clinical judgment, counseling, organization efficiency, and overall clinical competence. Okay? Clear? However, what happens is that if you are just observing a student for 10 to 20 minutes, do you think you will be able to see each of these things? Not possible. And that is why not observed, no option. So, not observed, આ બી આવી શકે, આ પણ આવી શકે, બધા આવી શકે. Okay? So basically, I'll tell you again, 10 to 20 minute encounter, you are observing for these 7 qualities, and each quality you are going to rate between 1 through 9. So 7, 8, 9 is superior, 1, 2, 3 is unsatisfactory, and 4, 5, 6 is satisfactory. Clear so far? Yes.
Not observe means that student has not asked or not mentioned the
ના.
things કે આપણે observe નહીં કર્યું. તો પછી evaluation નો મતલબ શું
હા,
કહેવાય?
એટલા માટે જ multiple evaluations are necessary, because it is not possible to evaluate 7 qualities in a single encounter. એટલે આવું ટેક્સ્ટમાં લખેલું છે, આપણે તો એકવાર કર્યું નથી, so I think text should be more authoritative in saying so. આપણે એકવાર કર્યું
પણ
નથી.
એવું ના હોય ને કે તમને કેસ આપે પણ કોઈ છોકરો કન્સેન્ટ લેવાનું જ ભૂલી ગયો હોય કે પેશન્ટને કમ્ફર્ટ કર્યા વગર જ સીધું એક્ઝામિનેશન ચાલુ કર્યું. That means that part was missing in that student. એવું હોય કે
So
તો not observe on the from that student perspective or the આપણે જ નથી જોયું એવું જ તો.
okay, I'll reiterate. આ 7 વસ્તુઓ એક્ઝામિન કરવાની છે એક એન્કાઉન્ટરમાં. Now it is not possible to encounter everything in a single encounter. Okay, there are at least 500 studies that have been done on it, and I am telling you the results of it. So it is very futile to really counter it, but still. So what do we do? So I say that there is one student who has come and he is telling me, "Sir, mare aa રીતે કરો." So I'll tell him, let's see point number 3 and 4 today. Or you may not even tell him. You may keep it to yourself, and you may write by yourself કે હું આનો point number 1 અને 2 આજે observe કરવાનો છું. He finishes his encounter and you judge only those 2. Does it make sense or still there? So what happens is, now students point number 1 and 2 got judged today. He keeps that mini CEX form with him, files it in his portfolio, done. He goes to another assessor in medicine and there's another patient and he says, "Sir, mara mini CEX karvanu chhe." He goes there. Then point number 3 and 4 maybe also. So for one student, numerous case scenarios are also required and varying assessors are also required. ત્યારે જઈને મિની CEX નું ટ્રુ જે એનો પાવર છે અથવા આપણે જે કહીએ કે that can communicate better, this method can communicate better, right? If we just take one mini CEX, it has no role, and that is the whole point. મેં જે આની આગળ જે કીધું, if you see this, single encounter is not sufficient, need more encounters with varying scenarios and different assessors, right? So this is the form. The first part is changeable, this is the second part. Okay, however what happens is there are colleges or there are hospitals that have made it mandatory that if you give 1 or 2 to any student, then you have to mention why. Do you get it?
આપણા પારમાં છે એવું પારમાં મિનિમમ થી ઓછું હોય છે
Yes.
રીઝન લખવાનું એકદમ સારું લખે તો રીઝન
And that was the second part. There are some colleges which have made it that if you give someone 9, then also you have to justify in writing. So why did you give 9? Okay? Okay, so this is the third, સૌથી નીચેનો part છે એનો, which is like, which was, how much was the time, and then, what was the evaluator's satisfaction, what was resident satisfaction. There will be signature of both. It will be in 2 copies. One will stay with the teacher and one will stay with the learner. So this is mini CEX. Okay?
यूज ऑफ इट
Sorry?
यूज क्या था
This is clinical.
Evaluation satisfaction ને resident satisfaction એટલે બંને જ
ઓકે, હું કહી દઉં. આ જે છે એ ABIM એટલે અમેરિકન બોર્ડ ઓફ ઇન્ટરનલ મેડિસિને કર્યું હતું ને એને પ્રાઇમરીલી રેસિડેન્ટ્સ માટે કરેલું છે. એટલા માટે અહીંયા રેસિડેન્ટ લખ્યું છે, which means કે જે છોકરાની પરીક્ષા થઈ રહી છે એ
પણ સાઇન કરે.
એ પણ સાઇન કરે.
એ રેસિડન્ટ સેટિસ્ફેક્શન વિથ મિની CEX એ જે લખ્યું ને સેકન્ડ
હા, એટલે એને પોતાને એ જજ કરે કે મને તમે જે રીતે બધું થયું એ મને બરોબર લાગ્યું છે.
ઓકે
એ પીજી માટે તો આપણે અહીંયા યુજી માં
એટલે આપણા માટે NMCA રેકમેન્ડ કરેલી જે મેથડ છે ક્લિનિકલ સ્કિલ્સ એસેસમેન્ટની એમાંનું આ એક છે મિની CEX.
એટલે આમાં રેસિડેન્ટ જો 1 2 કે 3 આપે તો એની એક્ઝામ ફરી લેવી પડે, ફરી એનું મિની CEX થવું પડે.
એ નથી કે આઈ કેન રિયલી રીડ અબાઉટ ઇટ એન્ડ કમ બેક.
apply anywhere in India or not?
અમુક જગ્યાએ થાય છે.
DNV ની એક્ઝામ લે છે
આ તમે કહેતા હતા 30 પોઈન્ટ હોય છે એમાં.
હા, એ પ્રેક્ટિકલમાં આ રીતનું જે
લો ને
મોસ્ટલીમાં
રીઝનિંગ કીધું તો
one part છે
તો
તો
લો કે આવી તો એના
રેસિડન્ટ
રીઝનિંગ
મૂકે છે એમાં પોતાના માર્ક.
હે
રેસિડન્ટ પોતાના માર્ક મૂકે છે
ફીડબેક ત્યાં પૂછે છે,
ક્યાં
DNP વાળા પૂછે છે,
કોઓર્ડિનેટર ને બધા હોય ને
ટેસ્ટનું બધું
પૂછે
પૂછે
કે
છે.
બોલીને પ્રિસેપ્ટ
એ
પૂરા
જાય.
માર્ક દે મને કોઈ ક્વેશ્ચન માર્ક નથી આપે એમ કહી શકાય.
આ વિવેક જ છે રેસિડેન્ટ.
So basically, except this central part, usually this upper part or the lower part are usually variable. A lot of institutes make changes what they deem appropriate. Okay, so this was about clinical skills. Now comes DOPS, which is about practical skills or psychomotor skills. It is the same. Okay, so koi જેવો લાંબો ફેર નથી. Stands for direct observation of procedural skills. It is the same as mini CEX. DOPS માં તમને you have that leeway that you can make your own form, like you can create your own form around it, what it is, I'll tell you. So like injections or NG tube insertion, veiny puncture, peritoneal catheterization, etc. So if you want to test them, so the skills that are assessed are understanding, indication and relevant anatomy. આ બધું જો તમે નક્કી કરો કે તમારે ડોપ્સ સ્ટેશનમાં રાખવું છે તો it is not necessary, બરોબર? કારણ કે આપણે ધારો catheterization નો ટેસ્ટ લેતા હોઈએ તો it will of course be on a mannequin. Okay, it will not be on patient, right? Obtaining consent, you can check if pre-procedure steps were done. Yes.
I think nursing students ને આપણે વોર્ડ માં એ લોકો ડોક્સ કરાવે છે.
Acha, okay. Right. Aseptic technique, you can check if there was analgesia was used. So these are suggested things that you can check through DOPS. It is similar, rating scale is similar, so this is part 1 of the form, this is 2 sides of the form. The same details around.
આ થઈ શકે.
Yeah, I mean this is same. Now, as I was talking about Peyton's model, where if you want to teach venesection, you have to define the steps. The same way for how many ever DOPS that you want to create, catheterization, NG tube insertion, anything, you have to define it. Because that is when you will be able to tick that આ step and કર્યું.
સપોઝ ઇન્ફોર્મ કન્સન્ટ છે એમાં 9 સ્ટેપ અપાય છે 1 to 9. એ કેવી રીતે ડિસાઈડ કરવાનું? હાઉ ટુ ડિસાઈડ ધ સેકન્ડ પોઈન્ટ, થર્ડ પોઈન્ટ, ફોર્થ પોઈન્ટ, ફિફ્થ પોઈન્ટ, સિક્સ્થ પોઈન્ટ?
No, actually For all of this, there are assessors trainings. Okay, so ideally, even our training as a assessor needs to be done separately. As an assessor, I'm saying, okay. See, assessment is a huge thing, okay. Like, because if you see, why should anybody study? To pass in the exam. So the basic tenet of any education, the basic tenet is same, that assessment drives learning. If there is no assessment, there is no impetus to learn. How much ever I loved biostatistics, I did not study it till now, because I have to appear for an exam. So assessment drives learning. That is the basic funda. So that is why it is said that if someone asks you that what is CBME, Dr. Tejinder Singh, who's a pediatrician and who's a writer of few books on medical education. So when someone asked him that what is CBME, he gave only two-worded answer, which means good assessment. That's it. If you can just provide good assessment, everything else will fall in place. And that is what is systems approach. Systems approach પહેલા શું હતું કે ઓબ્જેક્ટિવ TLM અને આ ત્રણે વસ્તુ કોઈ પણ એક વસ્તુમાં ફેર કરવો પડશે તો you will have to change all three. Otherwise it's all dominoes, right? So this is the same form, direct observation, procedural skill. Now if you see same, basic details, you can rate that, whether understanding of indications is there or not. You can unsatisfactory, satisfactory and superior, and if it was not observed, then you can say no, this was overall performance. Here you can say there was any specific feedback by the assessor, if there were any training comment, or if there are any areas of learning which has been identified. So these forms are also very malleable. તમે જાતે બનાવી શકો. ડિપાર્ટમેન્ટમાં ધારો if we know that we have 10 procedures, actually CBME there are 12 procedures which are certifiable skills in surgery for undergrads. So we can make these forms for all 12 of them, and they are there. So any student comes, then you don't have to like really teach out of or assess out of your mind. You just grab a form and then start to take the exam. Okay, it makes it extremely protocolized. Okay, I think with that I end. These are the 3 books I highly recommend. Actually, I have these 2 right now. Soft copy much, and I often refer to it. So that is it. Thank you. These 2 I have purchased. I have them. In fact, I referred to this one yesterday and earlier this one. Dr. Tejinder Singh. You can read the name. Okay, so he is a pediatrician. And I earlier maybe said in this forum or otherwise, there is a lot of hue and cry around that clinicians don't have time to teach. So Dr. Tejinder Singh is in a medical college. He is a professor in pediatrics. Dr. Dikshit, Dr. Sheshadri, he is also a professor in probably pediatrics. He is, and Dr. Avinash Supe, if you all know hepatobiliary surgeon, he is also a huge name in medical education. So I think clinicians, Dr. Avinash Supe. બરાબર એટલે એવું બી નથી કે just because
કેટલાની પડે 3
I have a soft copy of this, but these 2 I think
અંદાજે કેટલાની પડતી હશે
I don't know about this, but these 2 must be around 2,000 rupees probably. બંને થઈને
આપણે એચઓડી બેઠા છે પેલી લિસ્ટ મોકલે એમાં આપણે આ મૂકી દઈએ ને
લિસ્ટમાં we can ask. લિસ્ટમાં we can ask.
भी आराम में
લિસ્ટમાં and if there's a new list, we can of course ask. Yes, of course ask.
આ ત્રણે તમે ધ્યાનમાં રાખીને લખાઈ દેજો
સુપ્રિન્ટેન્ડન્ટ સાહેબ લખાઈ દેજો એડિશનલ HOD ને કહી દેજો.
ગુડ સજેશન.
એ રવિ, આ નોટ ઓબ્ઝર્વ છે ને હજી સેટ નથી થતું. એ તું કંઈક એક્સપ્લેન કર.
એટલે એમાં
નોટ ઓબ્ઝર્વ
એટલે આપણે જોયું નથી એ પાર્ટ